Have you ever noticed yourself running to the bathroom more often than usual? Or maybe you're constantly feeling thirsty, no matter how much water you drink. Or perhaps you're always feeling tired, even after a full night's sleep. These might seem like small, everyday issues, but they could be early warning signs of diabetes. Diabetes is often called the silent epidemic for a reason. Right now, over 500 million people worldwide are living with it, and millions more have no idea they have it. In fact, in the US alone, more than 7 million people are unknowingly walking around with undiagnosed diabetes. Why? Because the early symptoms are often subtle and easy to dismiss. But the real danger isn't just high blood sugar. It's what happens over time. If left unchecked, diabetes can gradually damage your nerves, weaken your immune system, and put extra strain on your heart and kidneys. And the scary part? Most people don't realize the damage is happening until it's too late. But here's the good news. Your body does send warning signs. You just need to know what to look for. So, in today's video, we're uncovering the 9 silent signs of diabetes that you should never ignore. Some of these might surprise you, but spotting them early can make all the difference in preventing serious complications. And at the end of the video, we will also give you some general tips to keep your blood sugar in check and avoid going into diabetes. Let's dive in and break it all down. Number 1. Frequent urination. Have you noticed yourself running to the bathroom way more often than usual, especially at night? At first, it might seem like a minor annoyance. Maybe you think you just drank too much water, or it's the colder weather making your bladder more active. But if this keeps happening, there could be something deeper going on. This is because when blood sugar levels are too high, your kidneys struggle to keep up. Their job is to filter out excess glucose, but when there's too much, they flush it out through urine, taking a lot of water with it. This leaves you dehydrated, which then triggers more thirst, and before you know it, you're stuck in a cycle of drinking and urinating nonstop. Frequent urination, especially waking up multiple times at night, is often one of the earliest signs of diabetes. So, if this is something you've been experiencing, don't just write it off as normal. Your body might be trying to tell you something important. Number 2. Excessive thirst. Excessive thirst, also known as polydipsia, often goes hand in hand with frequent urination, forming a cycle that's hard to miss once you start noticing it. But why does this happen? As mentioned earlier, when blood sugar levels are too high, your kidneys work overtime to remove the excess sugar, flushing it out through urine. But in the process, your body also loses a lot of water. The more fluids you lose, the more dehydrated you become. So your body demands even more water to compensate. But this isn't just your average thirst after a workout or a salty meal. It's persistent, intense, and almost impossible to quench. Even after drinking a full glass of water, you might still feel dry-mouthed and desperate for more. Now, here's why this matters. Chronic dehydration can take a serious toll on your health. It can lead to fatigue and headaches and even put extra strain on your kidneys and heart, both of which are already at risk if you have diabetes. And the scary part? Many people don't associate excessive thirst with a potential blood sugar problem until other symptoms appear. So, how do you know if your thirst is something to worry about? If you find yourself drinking over 4 liters, about a gallon of water a day, and still feeling thirsty, it's time to pay attention, especially if this is paired with frequent urination or constant fatigue. Number 3. Weakness and fatigue. Everyone feels tired now and then, but what if your exhaustion never seems to go away? What if, no matter how much you sleep or how well you eat, you still feel drained, sluggish, and unable to focus? If this sounds familiar, your body might be struggling with high blood sugar levels. Here's why. Glucose is supposed to be your body's main source of energy. But when you have diabetes, either your body isn't producing enough insulin, or it's not using it effectively. This means that instead of fueling your cells, sugar stays trapped in your bloodstream, leaving your muscles, brain, and organs running on empty. The result? Persistent fatigue that no amount of coffee or extra sleep can fix. But that's not the only problem. Your kidneys are also working overtime to flush out the excess sugar, which can lead to dehydration. And when your body loses too much fluid, your blood volume drops, reducing oxygen and nutrient delivery to your cells. This makes you feel even weaker and more sluggish. You might notice that simple tasks like climbing stairs, carrying groceries, or even staying focused at work start to feel much harder than they should. Many people brush off this kind of exhaustion, blaming stress, aging, or just a busy schedule. But if you constantly feel drained for no obvious reason, and especially if it's paired with other symptoms like excessive thirst or frequent urination, it's time to take it seriously. Number 4. Repeat infections. Do you feel like you're constantly battling infections? Maybe it's a urinary tract infection that keeps coming back, frequent yeast infections, or even slow-healing cuts and scrapes. If you've noticed that you're getting sick more often, or that minor wounds take forever to heal, your blood sugar levels could be to blame. When blood sugar levels are too high, the immune system weakens, making it harder for your body to fight off bacteria, fungi, and viruses. At the same time, excess sugar in the bloodstream creates the perfect environment for infections to thrive, especially in warm, moist areas like the skin, gums, or urinary tract. This is why people with undiagnosed diabetes often deal with recurring infections such as urinary tract infections, yeast infections, and gum disease. Even minor cuts or scrapes can become a bigger issue when the body struggles to repair itself, leading to wounds that take longer to heal. Many people don't immediately link these frequent infections to diabetes. They assume they just have a weak immune system or bad luck. But when infections keep coming back even after treatment, it's a major warning sign that something deeper is going on. Number 5. Deadly infections. Deadly infections are one of the most dangerous yet overlooked complications of diabetes. Unlike heart attacks or sudden drops in blood sugar, infections don't always trigger an immediate alarm. Instead, they creep in silently, getting worse over time, sometimes without any noticeable symptoms until it's too late. This is because, as mentioned earlier, diabetes weakens the immune system, making it harder for the body to fight off bacteria and heal wounds. Even a small cut, blister, or scratch can become a serious threat if left untreated. High blood sugar also creates the perfect environment for infections to thrive, especially in the feet, where poor circulation and nerve damage make it easy to miss early warning signs. That's why many diabetics don't realize there's a problem until the infection is spread, leading to severe complications like gangrene or sepsis. Sepsis is one of the most dangerous outcomes of an untreated infection. It happens when bacteria enter the bloodstream, triggering a full-body inflammatory response that can cause organ failure. This condition can be fatal within hours if not treated in time. And even with medical intervention, survival rates drop significantly once sepsis takes hold. Foot infections are another major concern. Since diabetes often causes nerve damage, many people don't feel pain in their feet, meaning infections can go unnoticed for too long. What starts as a small ulcer or unnoticed wound can escalate to a life-threatening condition. In severe cases, amputation becomes the only option to stop the infection from spreading further. The best way to prevent deadly infections is to be proactive. Keep a close eye on any cuts, wounds, or sores, especially on your feet. If you notice redness, swelling, warmth, or slow healing, don't wait to get it checked. Even a minor infection can turn deadly if ignored. Proper foot care, good blood sugar management, and early treatment can make all the difference. Number 6. Extreme hunger. Feeling hungry from time to time is completely normal. But what if you're constantly starving, even after eating full meals? If you find yourself reaching for food all day and never feeling satisfied, it could be more than just a big appetite. It might be your body's way of warning you about a serious issue with your blood sugar. When everything is working properly, your body converts food into glucose, which then enters your cells with the help of insulin, providing you with energy. But when diabetes interferes with this process, glucose stays trapped in your bloodstream instead of fueling your cells. As a result, your brain thinks you're running low on energy and sends hunger signals, even though there's already plenty of sugar circulating in your blood. The frustrating part? Eating more doesn't fix the problem because your body still can't use the glucose properly. This can create a vicious cycle. You eat, your blood sugar spikes, but since your cells aren't absorbing the glucose, your energy levels stay low. Your brain then tells you to eat again, and the pattern repeats. Many people with diabetes experience intense cravings for carbs and sugary foods because their bodies are desperate for quick energy. Unfortunately, giving in to these cravings only makes the problem worse, leading to even higher blood sugar levels, insulin resistance, and long-term health complications. What's tricky about extreme hunger is that most people don't immediately associate it with diabetes. They assume they just have a fast metabolism, are stressed, or aren't eating the right foods. But if you're eating more than usual, struggling to feel full, or feeling shaky and irritable between meals, it's worth paying attention. Number 7. Tingling or numbness in hands or feet. Ever get that tingling or numb feeling in your hands or feet and just shake it off, thinking, maybe I slept on it wrong or it's just poor circulation? It might seem harmless at first, but if it keeps happening, especially without an obvious reason, it could be a sign that high blood sugar is affecting your nerves. When your blood sugar levels stay elevated for too long, they start to damage the small nerves in your body, particularly those in your extremities, your hands, feet, and toes. At first, it might feel like a mild pins and needles sensation, a slight burning, or even an odd buzzing feeling. But as the damage progresses, the symptoms can worsen, leading to sharp pain, weakness, or complete numbness. The scariest part? If your feet go numb, you might not notice small cuts or blisters. And since diabetes also slows down healing, a tiny wound can turn into a serious infection before you even realize it. Number 8. Blurry vision. Ever had a moment where your vision suddenly feels off, like things look fuzzier than usual, or you struggle to focus even when your glasses or contacts are fine? It's easy to blame it on tiredness, too much screen time, or just needing a new prescription. But if your vision is going blurry out of nowhere and it keeps happening, your blood sugar might be the real culprit. High blood sugar affects more than just your energy levels. It can directly impact your eyes. When sugar levels spike, fluid can build up in the lens of your eye, causing it to swell and change shape. This makes it harder for your eyes to focus, leading to blurry vision that comes and goes. At first, it might just seem like a minor annoyance, but if left unchecked, high blood sugar can damage the tiny blood vessels in your retina, increasing the risk of serious eye conditions like diabetic retinopathy. Over time, this can lead to permanent vision loss. So, if you've noticed sudden or persistent changes in your vision, don't ignore it. Your eyes might be giving you an early warning sign that your blood sugar needs attention. Number 9. Unexplained weight loss. Losing weight without trying might sound like a dream come true for some, but if the pounds are dropping off without any changes to your diet or exercise routine, it could be a serious red flag, especially if you're also feeling tired, hungry, or thirsty all the time. When your body can't properly use insulin, it struggles to get glucose into your cells, leaving them starved for energy. To compensate, your body starts breaking down fat and muscle for fuel, leading to rapid and often dramatic weight loss. This isn't the result of a healthy metabolism working overtime. It's a sign that your body is essentially running on empty. What makes this symptom so sneaky is that many people don't connect it to diabetes at first. They might assume it's due to stress, a faster metabolism, or even a good thing if they've been trying to shed some weight. But unexplained weight loss, especially when combined with other symptoms like frequent urination, extreme hunger, or fatigue, should never be ignored. Alright, so there you have it. 9 silent signs that might indicate your blood sugar is out of balance. Now, let's discuss some simple steps to manage your blood sugar and prevent diabetes by making a few simple lifestyle changes. First, focus on eating a balanced diet with plenty of vegetables, lean proteins, and whole grains. Cut back on sugary foods and processed snacks that can spike your blood sugar. Second, stay active. Aim for at least 30 minutes of moderate exercise most days of the week. This helps your body use insulin better and lowers blood sugar. Third, maintain a healthy weight. Even a small amount of weight loss can improve how your body processes sugar. Fourth, drink plenty of water. It helps your kidneys remove excess sugar and keeps you hydrated. Fifth, prioritize sleep. Aim for 7 to 8 hours of sleep each night, as poor sleep can affect your blood sugar levels. Sixth, manage stress. Chronic stress can raise blood sugar, so find ways to relax and unwind. Finally, monitor your blood sugar levels, especially if you notice any symptoms. Early detection can make a big difference in preventing complications. By following these simple steps, you can keep your blood sugar in check and lower your risk of diabetes. And if anything feels off, don't hesitate to contact your doctor. The sooner you address it, the better. Thanks for watching. If you found this video helpful, please like it and subscribe to our channel for more informative content. See you in the next video.